Morning, everybody. Welcome to Sundays at Summit Health. Happy to be here with you this morning. I know this is earlier than I typically post, and that is because I've decided that I just need a kind of a lazy day. Um, Been a long week, even though it was a shortened week for most of us, and it's okay to get your things done in the morning and then just kind of take it easy the rest of the day. So that's my plan, and I hope you all have some time to relax today too. Um, Today we're going to cover a topic that I get tons of questions about, and honestly, that I had tons of questions about myself. And I just know it's something that so many people are dealing with and working through, and that is birth control. We get asked a lot, how does birth control affect my weight loss journey? Could it be the reason I'm not losing weight consistently? And the short answer to that is yes, it could be the reason. And it most likely, if you're on some sort of hormonal birth control, it is most likely having some sort of effect on your weight loss. Now, I want to put the disclaimer out there that everybody's experience with birth control is different. Everyone's reason for taking birth control can differ quite a bit, and there is no blanket statement, yes, you should be on it, or no, you shouldn't. So that is not what I'm here to say, is that you should go off birth control or you shouldn't go off birth control. I simply want to talk through some of the effects that it can have on your body that you might not know about. Um, and I'll share a little bit of my personal experience as well as some other case studies that I've come across. Um, and the point of that is just being we're often uninformed um, about the full effects of birth control. It's something our doctors don't always do a great job of talking through with us. I hope that's not the case for you, but if you've gone through what I've gone through, they focus a lot on the effectiveness of the birth control and maybe mention some side effects. Rarely do you get an in depth description of what the side effects are, how long they last, how long does it take to get rid of them when you come off, what other side effects pop up when you do come off, and those types of things. And so I just wanted to make sure that I talked through some of those so that if birth control is something that you are considering, you have a better picture of everything that comes along with it. So, could it affect your weight loss journey? Yes. The long answer, though, is that it depends. So, for a lot of women, specifically around 18 to 30, they take birth control for a lot of different reasons. Usually, it's to prevent unwanted pregnancy, but it can also help teenage girls regulate their cycles or control their acne. I did learn in a podcast, however, that until your early 20s, using it to regulate your cycle can actually be harmful to your cycle's rhythm long term. And so, classic story, high school girl, your cycle's very irregular. Your mom takes you to the doctor, and the doctor puts you on birth control to help regulate your cycle. The issue with that is when you are an adolescent and just starting to become a woman, your body is figuring out its cycle. The same way a toddler is learning how to walk, when they first do it, it's not going to look great. They fall down a lot, they're very wobbly. Sometimes they can make it all the way across the room, and sometimes they fall down as soon as they stand up. Nobody would look at that and say, he's not walking perfectly. We probably should, look into this. Let's correct it. Let's go to therapy. Let's put braces on his legs. The immediate thought is he's learning how to walk. He's figuring it out. And part of your body and your brain learning to figure something out together is giving them the time to kind of make mistakes and figure all of the things out. And what a lot of women don't know is that our periods and our cycles are that way to begin with. And then eventually they should even themselves out. I know, again, that's not the case for everybody, but when we use birth control to regulate our cycle so early on in our womanhood, later in life when we go off birth control, our body still needs to go through that process of figuring out a regular cycle, which is why many women who in their 30s are coming off birth control and they still don't have a regular cycle. And that makes them feel like they need to stay on it, even if they're not using it for its intended purpose of preventing pregnancy. So, something again to discuss case by case, but if you are early on, even in the first 10 years of your womanhood, give your body a little bit of time to adjust itself and know that that awkward stage kind of has to happen regardless. Myself, I would rather get it out of the way as a teenager and not have to deal with it the rest of my life. But I also understand that being a teenager is not easy and you need to do what you have to do. So, definitely a decision to discuss with your doctor, but just keep in mind some of the long term effects as well as you're considering that decision. Um, Moving on a little bit, birth control is really, really effective in preventing pregnancy and regulating cycles, controlling acne, but it also has some really big risks. And possibly the biggest one is putting yourself at an increased risk of cervical, liver, and breast cancer. That is scary to me and something that was not discussed with me when I was put on birth control. Another side effect, though, is often an increase in body fat, which affects a lot of our clients, specifically in your lower body and your upper arms. It makes it extremely difficult to lose fat in these areas, even if you're exercising more and decreasing your calorie intake. For some reason, when we're on birth control, those areas just will not let go of any fat. I read through a few case studies and came across a few where a client had been on a birth control for years and then went off of it, and their body fat decreased within 2 months, and that was without changing anything as far as their exercise and calorie intake. Now, these girls were pretty lean to begin with, and they didn't have a super hard time staying in shape, but if they ever went off track, like we all do, a weekend, it's your birthday, whatever. If they ever went off track, they'd immediately backslide in a way that seemed almost impossible to come back from. And if they tried to get leaner, like for a competition or anything like that, they couldn't do it. A lot of the other side effects go far beyond our physical health, and from my own experience, I would argue that they're worse. First off, many women report a decrease in their sexual desire and arousal and discomfort during sex. So, this is obviously really tough on us emotionally and can really strain relationships when you're not on the same page as your partner sexually, which we know that our relationships affect our physical health. So, even though this seems like something that's more emotional, more on the soft side, strained relationships, especially within your own household, can affect your physical health. So, what exactly causes these side effects? Hormones. If you are taking a pill or having something in your body that affects your hormones, you are chemically preventing one of the principal functions your body is designed to carry out. And you're doing that by altering your hormonal environment. So, because everyone's starting place when it comes to hormones is a little bit different, different types of birth control are going to affect everyone differently. For some people, like myself, it was terrible and I'll never do it again. For others, like my own sister, an unwanted pregnancy for her would be worse than the side effects of birth control because she doesn't want to be a mom. She has a lifestyle. She loves to hunt and fish and travel and be gone on the weekends. And her husband are like, we don't want kids. So for them, she doesn't have as many side effects as I do. And she doesn't want an unwanted pregnancy. And so for her, birth control is a great fit. It does everything it's supposed to do. For me, somebody who is probably as chemically close to her as possible, it did not go well. And so it really is a case by case basis. What fits in with your lifestyle? What would unwanted pregnancy look like? What would a little bit of weight gain or loss look like? Those are all the factors you have to weigh beyond just the pregnancy. You also need to weigh out some of the other things that you are gaining or giving up when you decide to go on birth control. Every birth control is also not the same. So it's good to discuss certain options with your doctor. And if one type didn't work, you can always try a different one. Um, so even though they work great as contraception, you're still altering your hormonal setup, which has effects on your physique and your overall health. Interestingly, many women report a depressive or down mood when they're on birth control, and many of the same symptoms that we deal with, interestingly enough, are a reason that a men's birth control study was shut down by the FDA. So they tried to create a hormonal birth control for men, and men reported a lot of these symptoms, mainly a decrease in sexual desire and also depressive or down mood. And the FDA looked at that and said, that's actually enough that we're going to shut this down. This is unsafe to these men. Even though women report the same things and often worse, and it's still okay for us to take hormonal birth control. So I just thought that was interesting. Not saying that I think men should have to suffer through birth control, but it is interesting to consider that women are often willing to do it, and many of the men in this study weren't. Things that can happen as a result of birth control. So, kind of just bringing this full circle. Not all of these will happen, but things that can happen as a result of birth control. One, you aren't losing weight no matter what you do, exercise wise or complying with your diet. Birth control could be an obstacle that you're facing. The trade off of gaining a little weight or not being able to lean out might be worth it to prevent an unwanted pregnancy, say for a college student or a young professional or just somebody who doesn't want kids. That might be worth it for them. Sexual desire could decrease, which strains relationships and thus strains health. It could make it really hard to lean out if you are working really hard. It also can lead to quicker weight gain. If you took a break from working out or eating clean, you could see the reverse fairly quickly in your hard work. But when you come off of birth control, that seems to reverse itself fairly quickly. You could see a change in mood, whether that's just not feeling like yourself, feeling sleepy or tired a lot of the time, not wanting to work out when you previously loved it, those types of things. And if you take progesterone as your form of birth control, that's when the couple days like before your period starts, how you feel, just like a little bit irritable, a little bit tired, a little bit bloated. When you're on that birth control specifically, that's how you feel all the time, and you almost forget what it feels like to have the more energetic, more frisky, outgoing, want to move around person within you, and it feels like that can go away sometimes. So what do I do with all this information? First, research what options are out there and don't just go with the first thing that your doctor recommends. There are non-hormonal methods like copper IUDs or condoms that you can use for birth control. But even if you do decide to go with a hormonal option, that's perfectly fine. keep an open mind to the fact that you might have to try a couple of them to figure it out, and talk through every option as well as doing your own research. Not every birth control will give you every side effect. So some people do fine on the pill but don't respond well to the injections and different things. So make sure to talk all of your options through with your doctor and be aware of the side effects and what's worth it to you and what's not. And then lastly, just remember that no bikini contest is worth an unwanted pregnancy, but no prescription is worth years of hormonal disruptions. So for you, think through, what am I gaining and what am I giving up by going on birth control or going off of birth control, and talk it through with your coach, talk it through with your doctor, and accept the fact that it might take a little while to figure out what exactly this is going to look like for you and how it's going to affect you. I would love to answer any questions, provide any resources. Thank you so much for listening. And if you want to share any of your own experiences or ask any questions, just throw those in the comments. Thank you.